Good morning, guys, and welcome back to Brief Conversation by Dr. Rehan Umar. I'm a consultant interventional cardiologist and an international diabetes educator, and we are in the month of November, which is the month of diabetes. We are in this year celebrating the 100th anniversary of the advent of insulin by Benton and Best, and we are shortly holding World Diabetes Day on the 14th of November. Uh, I just wanted to bring up the statistics of Pakistan as far as diabetes is concerned. We all know that at this point in time, and in 2021, the International Diabetes Federation issued its census on the number of diabetic patients in the world. 537 million diabetics inhabit the surface of this planet in 2021, and if the rate keeps on increasing, as we have seen, the last census held in 2019, and if you compare the statistics from 2019 and 2021, there has been a whopping 16% increase in the number of diabetics in the world. That's about 74 million. So there are now 537 million, and if we extrapolate this finding, if diabetes keeps on growing at this current rate, by 2045 we'll be having more than 730 million diabetics living on the surface of this planet, which is a staggering number of patients. We all know that diabetes is a very deadly disease. It used to be called as consumption in the past, along with tuberculosis, and it used to cause tremendous amount of complications. It still does if it is not treated aggressively and from the very beginning. If we talk about Pakistan, we are a nation of 220 million people. And out of those 20 million people, there are around about 33 million diabetics living in this country with diabetes, which is a hell of a number. And if the IDF has also issued a comparative analysis putting Pakistan as number one in the prevalence, rise in prevalence in diabetes at about 30 to 31%. So 33 million diabetics, 1 in 4 Pakistanis is a diabetic. 11 million Pakistanis are also having impaired glucose tolerance. That is, they are pre-diabetics. They are about to develop diabetes, but their HbA1c and sugar numbers are not exceeding the defined definition of diabetes. On top of that, there are 8.9 million Pakistanis who remain undiagnosed. They are diabetics, but they remain undiagnosed, just carrying on the stigma that how much dreadful complications we are going to anticipate in over coming years if these patients are not treated properly. If we talk about Pakistan, our country is not that rich of a country. If we look at the population of our country, we are the 5th largest country as far as the number of people inhabit in the world is concerned. We have 222 million people, and we know that there are top 5 countries in the world as far as the number of people are concerned, and these top 5 countries, they have a combined GDP of about 20%. They control the GDP of about 20%, and among those 5 countries, Pakistan contributes 0.6%. Why? Because we have more than 20% of our population, they live below the poverty line. And the daily earning in Pakistan is less than $3 per day. That is the stigma. So 1 in 2 Pakistanis, if he or she requires insulin, cannot afford it because of the poverty, because of so many economic constraints. So we need to take care of these important aspects into our consideration if we are gonna curb this pandemic of diabetes. We were scared of COVID-19, and there were not more than 3 million deaths all across the globe because of COVID. If we talk about diabetes alone, around 400,000 people die every year in Pakistan because of diabetes. If we talk about the complication of diabetes, like peripheral arterial disorders, we know that diabetes causes peripheral vascular diseases, and one of the commonest causes of amputations in the world in general, and Pakistan in particular, is diabetes. And there are more than 200,000 amputations per year that happen in our part of the world in Pakistan. So we know that this is a situation. We know that 1 in 4 Pakistanis is diabetic. We know that 1 in 2 Pakistanis cannot afford insulin. We know that we are living below the poverty line. We also know the complications of diabetes, like heart disease, stroke, kidney failure, peripheral vascular disorders, hypertension. And these complications can be only addressed if all the healthcare professionals, they come up with an idea of combining hands and coming up with a proposal to make medications cheaper, to make insulin cheaper, to make medications accessible to most of the patients. Only then we will be able to control this disease. So we should take care of diabetes, we should respect diabetes. This World Diabetes Day on the 14th of November signifies the importance of the unity among the healthcare professionals, and unity and the concordance and the coordination between the healthcare professional with the patients. So if we work in concert, maybe, a very strong maybe, we'll be able to win the fight against diabetes. We'll be able to treat diabetes the way we want to treat diabetes, and try to conquer over it. Thank you very much.